Being a nurse is a privilege, and it's something that since the 7th grade I wanted to do. Living a healthy lifestyle is extremely important to me. I get to live out my value of health and the importance of wellness in my work. I said I would never be an ER nurse because I didn't think that I could handle the chaos, but that is where I found nursing to be extremely exciting. A day in the life of an ER nurse is unpredictable, and you never know what's going to walk in the door, and that was part of the, I think, adrenaline that most ER nurses experience. I had a phenomenal mentor that saw something in me and brought it to the surface. I went from being a staff nurse in the emergency department to being a charge nurse, running the flow of the department throughout the day, which can be an incredibly stressful and crazy job. When my boss at that time was leaving, I took over as director of the emergency department, and that's where I really started my leadership career. I had the privilege of going through the executive development program, which was a great support from transitioning from a director of a department into an executive role where I'm driving the agenda of the whole entire hospital. After completing and graduating from that program, I landed the spot of Vice President of Nursing Operations for the Continental Division. Being in a leadership role is much different than being at the bedside. We have a very broad perspective, and we affect every single patient that touches our health system. And it's a privilege to serve in that capacity because we have the ability to raise the quality of care and safety for our patients within our communities. One of my favorite things being in this role and being at the division office is going and being with our patients and our staff at the bedside. It is the one thing that fills my bucket. If I'm having a tough day or I'm working on a tough project, I can go into any one of our hospitals and visit and hear the great things happening. At HCA Healthcare, it's important that not only we serve our patients inside of the hospital walls, but that we support outside of the hospital, which means supporting at different races locally that might support funds towards research or advancing healthcare in innovative ways. It's a privilege to be able to help our community partners in serving their missions as well. HCA Healthcare has invested heavily into me, and I think there are endless opportunities to develop your career and your profession. I get to live our mission, which is, above all else, we are committed to the care and improvement of human life, no matter if I'm in the boardroom or at the bedside with our patients. As a nurse, we have the capability to educate our communities while also showing compassion and kindness. Nursing is the perfect profession for me, and I absolutely adore what I do.